Speaker, it's a pleasure to speak in this debate, and I congratulate my honourable friend Frailsby for successfully bringing the bill forward to this stage. And I begin by welcoming the fact that this is both concise and precise legislation. Indeed, it's probably short enough that even the former honourable member for Rushcliffe, who didn't have time to read the Maastricht Treaty, could have skimmed this bill, which is about public safety in approved premises, these hostels in communities, which provide temporary accommodation for people who've been released from prison but are considered to present the highest risk to the community, so that they can get additional residential supervision and rehabilitation support. And as has been said, they also support people on bail, as well as high-risk offenders serving community sentences. And I share the concern that my honourable friend has set out that, regrettably, the number of deaths among approved premises residents have increased in recent years, with much of that driven by the scourge of drugs. And with over 2,000 bed spaces, it's important that there is a comprehensive drug strategy for the approved premises estate. Because taking drugs, aside from being illegal and damaging for individuals' health, will also undermine those rehabilitation efforts, which may therefore lead to more offending. And my North West Norfolk constituents would want action taken to deal with that. So I welcome this bill and the proposals to put in place a comprehensive framework for testing. Importantly, it's consistent with that operates in prisons. It is, of course, a sad fact that the bill is needed to ensure that a much wider range of drugs are included, so it covers prescription drugs, medicines and psychoactive substances. And I welcome that by including prevalence testing and putting it on a firmer statutory footing, we'll be able to track emerging trends so they're identified and react more quickly to changes in drugs use. And I know from the earlier stages of debate and in the committee and my honourable friend's comments today that the important issue of consequences for failing a drugs test has been considered, as this is critical. It's important that staff will, in the first instance, talk to the individual, point them to substance misuse organisations and get a plan to help them stop taking drugs. My honourable friend may have some information on the current data on how successful those efforts are after failed drugs tests. But ultimately, if that is unsuccessful, there should rightly be consequences, as he said, with police involvement or recall to prison if they've breached licence conditions. And once again in this debate, I turned eagerly to the commencement section of the bill. The Act comes into force only when regulations are laid rather than on the day on which it passes. So I'm sure my honourable friend, the Minister, will be able to assure me that those regulations are well developed and will be brought forward rapidly once this bill is on the statute book. It's a modestly sized bill, but drug use is a major problem that drives crime in our communities, whether theft to fund a habit or violence or other criminal behaviour when people are off their heads on spice or other substances. So this will help deliver on our commitment to put the people that put us here to help make their streets and communities safer. I'm pleased to support this bill today.